In yesterday's playoff game, Kansas City Chiefs quarterback Patrick Mahomes suffered an injury to his right ankle, and at various times during the game was seen holding both his ankle and his knee. Let's take a look at some of the things his medical team may be evaluating. He was sent to the locker room during the game for plain films or x-rays. Most likely they snapped an x-ray of the ankle to rule out a fracture of the fibula, which is very common, less likely the tibia. It's also very possible that they may have snapped an x-ray of his foot to rule out any kind of fracture of the small bones of the foot, and possibly his knee to rule out a fracture of the proximal fibula or anything else. This week, an athlete of his caliber may undergo an MRI, which looks at the soft tissues, MRI of the ankle to rule out any partial tear of the multiple ligaments, including the superior peroneal retinaculum, superior extensor retinaculum, tibiofibular ligament, inferior extensor retinaculum, flexor retinaculum, medial deltoid ligament, tibionavicular part, and the anterior tibiotalar part of the medial deltoid ligament. In addition, he may or may not undergo an MRI of the foot to rule out any injury to the delicate ligaments in the foot. Regarding the knee, we clearly saw that there was a valgus injury of the knee also. The knee has four bones: the femur, patella, tibia, and the fibula. Many times during a valgus injury, you may suffer a sprain of the medial collateral ligament, the MCL. Sometimes with MCL injuries, if indeed he did suffer an injury, you always have to take a look at the medial meniscus, which is a small strip of cartilage on the medial side, the inside part, which is connected to the medial collateral ligament, and the anterior cruciate ligament. We wish him and his family well and a speedy recovery.